At first, what is fasting? Fasting means abstinence from food or drink or both for health, ritualistic, religious or ethical purposes. The abstention may be complete or partial, lengthy or short duration or intermittent. So, what is medical fasting? Do you know fasting has been used for healing purposes since around the 5th century BC. The ancient Greek physician Hippocrates suggested that patients showing specific symptoms of illness should avoid eating or drinking as a form of treatment. Some doctors notice that when people are sick, they sometimes lose their appetite naturally, which they called a fasting instinct. These doctors thought that giving food to patients during these times might not be needed and could even be harmful because fasting was seen as a natural way for the body to heal itself. Our understanding of how fasting affects the body started to develop in the late 19th century. This happened when researchers conducted some of the earliest organized studies on fasting in both animals and humans. In the 20th century, as more became known about nutrition and the nutritional requirements of the human body, methods of fasting became increasingly sophisticated and a wide array of approaches emerged. For instance, fasting was used both to treat illnesses and to prevent them, and it happened in different places like hospitals, clinics, or even at home. In some cases, fasting could last for over a month, where people only drank water or calorie-free tea. They might also exercise and use enemas during this time. There are other methods called modified fasting where you can eat between 200 to 500 kilocalories per day. Just to give you an idea, adults typically need anywhere from 1600 to 3000 kilocalories each day, depending on factors like gender, age, and how active they are. Sometimes these methods also include physiological or spiritual therapy. The foods you can have during modified fasting usually include things like bread, vegetable broth, fruit juice, honey, or milk. Modified fasting is different from a very low calorie diet. With modified fasting, you can have up to 800 kilocalories per day, and it's usually done to help you lose a lot of weight. Intermittent fasting, on the other hand, means you can go through cycles of eating less. For example, you might fast for 24 hours, then eat normally for the next 24 hours. In the 21st century, we have seen that fasting can be helpful in certain medical situations, especially when someone is sick and has lost their appetite. However, whether fasting is good for overall health in other cases isn't entirely clear yet. For instance, some studies with humans have shown that intermittent fasting for about 15 days can improve how our body uses glucose with insulin. But studies with rodents have suggested that long-term fasting might lead to problems like glucose intolerance and the release of harmful substances from tissues. Thanks for watching. Please like and subscribe our channel for more videos.